Thank you very much, ladies and gentlemen. Myself and Kathy Fan are going to talk for the next few minutes about corrective jaw surgery, or orthognathic treatment as it's perhaps more commonly known. So why do we do corrective jaw surgery? The main reason we do it is when there's malalignment of the jaws and the teeth, so that the patient has problems with their bite, as you can see on the left-hand side of this screen. And it's a treatment which involves firstly using fixed orthodontic braces to put the teeth into the ideal position, followed by corrective jaw surgery to put the jaws into the right position, and creating this image you can see on the right-hand side of the slide with the teeth in an ideal bite, with a nice smile, and with a nicely balanced facial appearance. So, what sorts of reasons do we do this for? Function is one of the most common reasons. If you look at the slide at the top, you'll see that the lady whose images you've just seen could only actually bite together on her back teeth. That makes biting and chewing really difficult. It means that even eating the most normal foods is difficult. You can't bite into an apple. You can't eat a sandwich without leaving all the fillings spilling out. And an awful lot of the patients that come to see us talk about how embarrassing they find it, eating in social situations and thinking that people are judging them because of how they're eating. Then we have dental health problems. The way that the teeth bite together might actually be causing damage to the teeth or to the gums surrounding the teeth. And by doing something at a fairly early stage, it avoids quite often significant problems at a later stage in life, and perhaps even premature loss of the teeth. And then we've also got aesthetics, and that's aesthetics of the teeth and also aesthetics of the face. And we've heard already this afternoon about how important appearance is in today's society. We're all judged based on our facial, dental appearance all of the time, when we meet new people, when we're in social situations, when we're at work. And there's absolutely no getting away from the fact that appearance is really important. And then we have the slightly less common reasons for doing this type of treatment. Sleep apnea. That's a condition where patients have problems breathing when they're asleep, and it means they have severe snoring and potentially life-threatening effects. And by repositioning the jaws, that can have really life-changing effects for them. And then also situations where people have had injuries, fractures to their jaw, that we've already heard about earlier on, and also congenital conditions like cleft lip and palate, we've also heard a little bit about. These patients are also treated in this way. But in association with all of these physical factors is quality of life, and I think this is going to be a theme through the whole afternoon. Patients have a really dramatic effect on their quality of life as a result of having these sorts of physical problems. And we also heard a little bit about qualitative research earlier on. We've recently done some qualitative research in our department where we interviewed patients and asked them about how these problems affected them in their everyday life. And I've just selected two quotes from this research that I'll just leave up there, and I'll leave you to just read those for a few moments, and just to think about how you might feel if it was you feeling like that every day of your life. And we have quite a lot of evidence now that we do improve the physical and the quality of life, psychosocial aspects, when we do this type of treatment. But NFORC has given us a whole new way of looking at this. We're now collecting data for the whole of the United Kingdom. It allows us to get a national picture of the benefits that we're actually producing for our patients. And in doing that, it allows us also to make sure that we're producing the best possible outcomes for the patient in the best possible environment. And only by doing national research can we really achieve that. And that's something that we've not really been able to do at any stage in the past. So we wanted to just give you a little snapshot of the sorts of results that we get from treatment. You're going to hear from Graham in just a few moments. Graham's going to tell you a little bit about how he felt when he first came in asking for treatment. And he's going to tell you a little bit about how it's affected his life and what he's done in his life since having completed his treatment some years ago now. Here you can see the completely opposite type of bite, a patient with a very protrusive lower jaw, where the patient couldn't actually get his teeth together, difficulties biting and chewing, the same things that I talked about just a few moments ago. And then at the end of treatment, you can see that the patient has got a great bite, he can bite and chew the things he wants to do, he's got a fantastic smile and a really nicely balanced facial profile, and hopefully achieve that good quality of life that we're aiming for all of our patients.
Okay, this is just one of my patients. She first presented quite young, actually, one of the younger patients I treated. From a very, very early age, she was really quite unhappy about the way her teeth was and about her face. And I think you can see from the bottom picture that really she's going to obviously have problems with eating. So she underwent the treatment protocol that Professor Cunningham mentioned. She had braces to correct her teeth, put them in the right position. She then had jaw surgery. We brought her upper jaw forward, her lower jaw went back. And one can see she has a much more sort of balanced face and a really, nice dental outcome. She used to be quite a quiet, subdued individual. And I have to say now, I get quite a nice lot of pictures from her telling me that she's now at university having a great time. She's really confident and really enjoying life to the full, so it's really nice. I hope that's through with these series of individual patients, you get an idea of the sort of treatment and outcomes that we can get with orthodontic treatment. That's important. However, we have to look at the bigger picture. And that's where NFORC has come in, as Sue mentioned. NFORC has actually surveyed nationwide patients who've had orthodontic treatment. And this is some of the results that they've got back. So on over 225 patients, they were asked, following orthodontic surgery, how satisfied are you? Following treatment with regards to your teeth and your face. And we can see that 99% of the patients who've had orthodontic surgery were happy. You can understand why. People don't want to have a asymmetrical face, jaws which are disproportionate. They don't want to have teeth that stick out or not being able to bite. So you can imagine when these issues are actually corrected by orthodontic treatment and surgery, they can actually move on. These patients can often be teased and bullied, and it's quite difficult for them. From a more functional point of view, in terms of eating, we can see that the study also found that over 90% of patients were more relaxed when they were eating in public. And we forget, eating as an activity is really important. From a social point of view, we eat with family, we eat with friends. Also, increasingly in the workplace, there are business lunches that are increasingly common. And patients feel embarrassed, in business lunches, having to sort of tear the food from their back teeth. It's just embarrassing for them. So this type of treatment can actually affect them socially, as also improving their sort of work situation as well. The personal relationships, well, that's always quite a complex sort of issue, but around 80% of our patients following jaw surgery felt that the personal relationship were also improved. And that's quite a complex thing. Is it because they felt better about themselves? Is it because the treatment they've undergone has made them become more sort of average? Because, average values, they don't stick out anymore. People don't tend to, they just blend in. So perhaps, we don't know. We don't really know why their personal relationship, but it must be multifactorial. I think probably this slide is the most striking result. 98% of our patients have reported that following orthodontic treatment, they're more confident. And certainly we get so many reports of patients who then tell us that following their treatment, they've actually done better in their work. They've gone for that job interview that they didn't want to go for before. They've gone for that promotion. They've done better at their education. Well, the braces and the surgery certainly hasn't changed their ability, but perhaps it's that they feel better about themselves, and it's confidence which has allowed these patients to sort of go ahead and actually achieve their full potential. we hope that with what we've presented you can see that orthognathic treatment and jaw surgery is actually successful treatment. It's a treatment which has low risk and low costs. Most of the patients that we treat are fairly young, so we're talking about in their late teens and their sort of early 20s. And therefore, these functional benefits, these psychosocial benefits, actually are with these patients for an awful long time. We have some information about sort of the cost-benefit ratio of this treatment in small series, and that would suggest that the cost benefits are probably better than lots of other treatments which are carried out in the NHS. As sort of clinicians involved with patients who have orthognathic treatment, we know of the immense benefit that this type of surgery can give to patients. But, as I think one of our previously mentioned, there is only a certain pot of money. We are in a different financial situation, and therefore we do need more data, and I think this is where NFORC is going to come in. They're going to help us collate more data which will allow us to work out, is this treatment good? Who is it best for? We're not going to be able to give it to everybody, but we're hopefully going to be able to provide it to those patients who most need it, and it's going to be hopefully available or continue to be available on the NHS. I think at this stage we should hand over to both Sue and Graham, who are going to sort of talk to you about their experiences with orthognathic treatment. Thank you.
Good afternoon. My name is Sue Morgan-Elphick. I'm really sorry I don't have a presentation to put upon the overhead for you to see, or even a short film. You see, it's my face that tells the story. The face you see before you now, I wasn't born with. I feel I was truly born when I was 29. The years before, I think, I spent existing. I couldn't eat properly. I didn't know what it was like to eat an apple or a crusty piece of bread. I didn't really socialise. I felt an outcast, all because I looked different. I would be the first to joke about my appearance before someone else did, which would emotionally crush me. At the age of 15, I was first approached about my abnormalities by my dentist, who advised me about surgery I could have to make me look normal. He explained this would involve slicing down each side of my face to gain access to the jawbone. Then these bones would be broken and reset. Can you imagine how frightened I felt? Bewildered. It wasn't really explained why, and none of this wasn't discussed with me. It was directed to my mother. Once again, I felt abnormal, a nobody. To tell an emotionally wobbly teenager she wasn't normal was cruel. The thought of being sliced filled me with utter dread. I practically ran out of that door. This wasn't an option for me, I decided. I suppose from that moment onwards, I just accepted that I was different. I ignored the fact. The coper was born, I became the joker. After my parents passed away, I never really settled in one place. For over 10 years, finding it difficult to make roots, until I moved to this diverse city for life and work. You see, I'm a registered nurse. I have worked all over the country, working and gaining knowledge in multiple disciplines within the National Health Service. All the time listening and learning and gaining insight from both my colleagues and patients, maybe also trying to find myself. I eventually found myself working at St Bard's, John Abernethy Theatres, as a scrub nurse in a maxillary facial theatre with a certain Professor Ian Hutchison and a lot of his esteemed learned colleagues. Incidentally, I was a rubbish scrub nurse, as Ian often told me. It's nearly 20 years ago, come January, since I had the operation. 22 years before I met this man. He just came up to me a moment ago and asked me not to speak about him, and as him as a person. As I did in theatres, I ignored you then, and I'm going to ignore you now. The months I spent in the theatres, watched and listened with great interest, gaining insight into how there was so much variability between each and how each surgeon worked. The management of each patient is so individual, depending on the surgeon. My thought process deliberated over what surgical procedure would work best for me. I think being in the privileged position of actually working behind the scenes, I actually knew there was no certainty about what treatment would work best and how this uncertainty affected my decision making. No one knew about my inner turmoil. Working in theatres, I could hide behind a mask. Only my eyes could be seen. I was able to watch different maxillary facial surgeons work their magic, transforming faces, transforming lives. My decision was made. One Friday when we were on call, I don't know if you recall this, I was scrubbing up next to Professor Hutchison, and I asked him, would you contemplate operating on me? He responded, okay, come to my clinic on Wednesday. As easy as that. It took 29 years for me to come to this decision. I felt I'd gone through a cathartic process by working within the theatres, we're working within the discipline. Well, I turned up to the clinic, and so the planning of my surgery began. I was advised there was no certainty of what he'd do, but he said there would be no cutting down either side of my face. All the surgery would be done via my mouth. Please, no comments about the size of my mouth, thank you. My cheekbones are broken and grafts were taken from my hip bone to rebuild them. My upper jaw broken and brought forward more than 1.5 inches. My nose was realigned, and all this held in place by small metal plates. But what if I'd made the decision to choose a different surgeon? My surgery outcome could have been quite different, as there's no certainty. But now you see before you the new Sue, me, the bionic woman, as my son Tom and my daughter Emily renamed me. I was born again. I look more like my parents now than when at birth. I now have the face to fit the larger-than-life personality. I'm not frightened to stand up in front of you. I'm proud to be able to stand up in front of you. I've also had the pleasure of working with Saving Faces from when it first started, at the beginning of 2001, wasn't it? And so, in conclusion, I am absolutely delighted that for the first time, the UK has a national centre that will lead the world researching better ways to improve the physical, functional, social and psychological outcomes for the patients needing corrective facial surgery. I know that this centre will be able to determine the best treatment practice through its research. The surgeons will then have the facts which will help determine and eliminate uncertainty. This will enable them to choose what's best for their patients. I believe that through this research done at this centre, answers will be found for patients all over the world. Thank you very much for listening to me.
So, my story starts when I was about 6 or 7 years old, and all of my friends at school were getting visits from the tooth fairy, but never came to visit me. My little milk teeth, they just wouldn't come out, but that didn't stop my adult teeth from coming through, so I ended up with both sets in there, and that caused quite a mess. Things got pushed out all over the place. I ended up with a tooth in the roof of my mouth, which I had a great party piece I could spin a polo mint around on. That's an interesting one. And I ended up with a massive overbite. I could actually wedge a pound coin on its side between my upper and lower teeth. Don't try that one at home, kids. But things went on, and after the little game with the polo mint, things started to change, and the kids at school, as you can well imagine, started to come up with some rather different names than Graham for me. And it went on and on and on. And it began to really, really affect my confidence. I withdrew from a lot of my friend groups, and I just didn't want to be around people, and I just shrank away and spent a lot of the time on my own. And that then went on into later life, in my professional life, continued on into work, and as already been mentioned, a lot of time in meetings I was quite afraid that people just wouldn't take me seriously. They'd just see this ogre in front of them and, well, what's he going to know? You can't take him seriously. But it wasn't just the confidence thing. It was surprising little things that were actually functional that really had quite an impact on myself on a day-to-day basis. We've already heard, just something as simple as eating an apple or a peach, it was an impossibility. And again, it made things very, very awkward in social situations when we were out for meals. I was also forever biting my tongue and cheek, and so I was always with really quite sore ulcers in my mouth, and it often led to the air turning quite blue around me. And another one that when I went in to meet Sue, a question was posed to me, do you snore? Oh, yes. And in fact, it then came out, I really snored incredibly badly, to the point that people didn't complain about sleeping in the same room as me, they actually complained about sleeping in the same building as me. And I was like, well, what's that got to do with anything? And I was later to find out. I had been through orthodontics in my teenage years. I went to see a local orthodontist who tried an array of treatments, but to no real effect. And they basically got to the point when I was about 17, I think, that said, there's nothing really further that we can do for you. So I was left with the prospect of being this weirdo ogre for the rest of my life. So I was consigned to that, and away I went. Then in my 30s, I had changed dentist, and he suggested that I go and see these guys at the Eastman, and I met Sue. And another guy, Mr. Tim Lloyd, the surgeon who operated on me. They proposed a set of treatment which involved a lot of orthodontic braces and various things that I hadn't had before, different types, and proposed surgery. And although several people had offered to break my jaw previously, on this time I actually really wanted them to do it. And I'm so glad that they did. It was really quite a pain-free process, and at times quite entertaining. I remember many occasions with Sue, us trying to goad each other into who could come up with the most hideous colour combinations for all the elastics on my braces, much to the annoyance in the wedding pictures of my sister. But we went through the treatment, and it really has transformed me, and it's the particular kind of things that are being researched by NFORC that have turned my life and brought me back to feeling normal. And had I not felt normal, I wouldn't be stood here in front of you today. I'm quite comfortable with the way I look now, and I was able to go out with a great deal of confidence and start meeting other people and socialising a lot more. And I was then able to meet Anna, who's now my wife, and Charlie. So, it really is important, the work that NFORC do, to help make people feel normal and create families.